only two things that build muscle are exercise and branched chain amino acids, so protein. So let's look at some other aging changes. Just like humans, as dogs age, they're going to lose proprioception and balance. They're going to have a decrease in tissue elasticity, and they aren't going to have as much range of motion as they had when they were younger. And oftentimes these animals are painful, and they're going to have pain from degenerative joint disease. This particular hip, as you can see, is terrible. And as it says, often obese animals. This animal was pretty obese. We will look at him a little bit later. But as you can see, he has bilateral hip dysplasia. And you can believe that every time this pet's walking, that it's painful. So here's what we see with a typical geriatric patient. And this is one of my patients whose name is Cooper. And Cooper is actually wearing a help him up harness. That's what this is right here, because he has weakness in his back legs. So this help him up harness has a handle here and also a handle back here, so that his 82-pound owner can help him get up and down off the stairs by helping, to pick this up. But when Mrs. Client is looking at Cooper, this is what she sees. She sees him slowing down and reluctant to jump and sleeping more. He can't do the stairs. And she's looking at that and saying, I think he's just getting old. Well, not really, but she's worried because, sometimes he's confused. So she's very worried about his quality of life. So that's what the owner is seeing. And these are the things that I'm finding with a lot of the typical geriatric patients, and I did find these with our friend Cooper, that he had some arthritis. And then when we have arthritis, we often have painful muscles and joints. And we can have deficits, neurological deficits, that will manifest by the dog scraping and scratching their toes along the ground, and that's what the clients see, and they're concerned about that. Muscle weakness, this guy, if you're looking at the difference between just a straight orthopedic problem and one that is probably geriatric and involving the nerves, if we take and we push this dog this way, or we push this dog this way, in a young dog that simply has orthopedic pain, they're still going to be strong. They're still going to be able to stand there. You can maybe get them to step over a little bit and shift their weight, but they're going to be strong. Whereas if you do that with our friend here, he possibly could fall over. So because he's got muscle weakness. He does have some sarcopenia, and it's oftentimes that these typical geriatrics are also going to have gait abnormalities. So let's look at another patient of mine. This is Boomer. So this picture was Boomer in his prime. He was a hunt test dog. He was the top of his game, at one point, and the client loved to take him out. Boomer loved to hunt, but by the time he was about 5, he sort of retired from hunting, didn't do very much, laid around a lot, and his body condition score went from a 4.5, which is a great score for an athletic dog, up to a 7 out of 9. And, the owner didn't hunt very much either. The hunt test is actually a competition, but Boomer really did some actual hunting too, but they didn't do much hunting anymore with Boomer because he was really retired. And she noticed that he was limping quite a bit. And so, we don't want to make Boomer do anything too much, so he reduced his activity, he gained weight, and then his limping got a lot worse. So he was prescribed some Rimadyl, but the Rimadyl caused a really bad GI upset. In case you don't know what Rimadyl is a non-steroidal anti-inflammatory, and it's carprofen. And it's probably the most prescribed non-steroidal in the United States. In Canada, we prescribe a lot more meloxicam. This client came from the US to see me. But anyway, could not take any Rimadyl, and the owner was really concerned. So we did an exam, and we did some radiographs, and here's Boomer's radiograph, which we've seen already. So he had decreased hip extension, pain, he was overweight, he had some pain in his iliopsoas, back pain, and he was bunny hopping. These were the things that I found. So here's the thing. If we're looking at treating this patient, how about bilateral hip surgery? Well, that's not really feasible for this dog. We could keep him on chronic and non-steroidal